Hello guys, and welcome back to my channel. So if you're seeing me for the very first time, hi, my name is Sam. I am a registered nurse, a singer, songwriter, and a potential novelist. So in today's video, we will be going through the NMC practice questions provided by Pearson Vue. So I'll be taking you guys through the practice questions and trying as much as possible to explain them. I'll be doing some other similar videos to this, so if this sounds like something you are interested in, please make sure to like, comment, and subscribe. Without any more delay, let us dive right into it, guys. So to access it yourself, all you just have to do is to put into Google NMC practice questions Pearson Vue, and this would come up. So you can just click on it, and yeah, you can read this to be, the instruction says here for example, if the correct answer to a question is 5 ml, then the following responses will be marked as 5 ml. Then the following responses would be marked as incorrect: 5 ml of water, 5 milliliters, 5 mils, 5 ml. So it should be 5 ml just as it's written. So sometimes it's not that you are not getting it correctly, but you are just writing the answers the wrong way. Okay, so let's dive right into the question. So once you've read it all, just go ahead and you will see if you're to choose nursing or midwifery, you go ahead and choose nursing, because that's what we're doing right now. And then which branch of nursing are we doing right now? So we are doing that for adult nursing. We'll be doing, okay, let's just do adult nurse clinical part and numeracy part 1 first. Okay, again, please make sure to read all the instructions before you go. I think the numeracy is for 30 minutes. Here it's there. So once you've read the instruction, of course, you go ahead, select yes. So what is the volume that has been drawn up into the syringe? Please use the correct unit and write your answer to 1 decimal place. Always take note of the instruction. So this is 6.5. Now we have not been given a unit, so we're going to write it ourselves. What is the volume that has been dispensed? Please use the correct unit. 20 ml. A patient has been prescribed 2 liters of 0.9 sodium chloride. What is the volume in milliliters? That is 2000. Oh, you see, I just made a mistake. Now, all I just had to do was 2000 and needed not to put the ml because it's already there in your answer. So thankfully, it did not allow us put in that. If not, the answer would have been wrong. A patient has been prescribed 0.6 gram of ibuprofen. What is the dose in milligram? That is 600. Again, gosh. A patient has been prescribed 300 milligram of phentoin. How many tablets should be administered? Now, you can see on the packet that it says 100 milligram tablets. That means 1 tablet is 100 milligram, and your patient has been prescribed 300 milligrams. So what do you have to do? 300 divided by 100, which gives you 3. If you do not understand how I was getting some of the answers, please do make sure to leave your questions in the comment section and I will answer them, okay? A patient has been prescribed 1 gram of carbocysteine solution. I think carbocysteine is for, I can't really remember what it's for, but we use it here. Let me just search quickly. What is carbocysteine prescribed for? Yes, it is prescribed for treating and preventing respiratory diseases associated with thick mucus. So people with pulmonary diseases such as COPD and all, or people that generally produce thick mucus, they are prescribed carbocysteine and it helps them get better. So 1 gram of carbocysteine is prescribed, and we have 200 milligram per 5 mil. So in order to get 1 gram, we need to get, that's 200 milligram into 1000 milligram. That's how many 200 milligram is in 1000 milligram, which is 5. So we are going to give how many mil? So I don't want this video to be too long, so that's why it seems like I'm a bit, these are basic mathematics. So we have 200 milligram in 5 mil. That means we have x, no, 1000 milligram in x. And what is the answer if you cross multiply and everything? Our answer should be 25. So 25 mil. Take note of how I'm putting the units, ml, just like it's written in the question. So a patient has been prescribed 100 milligram of phenytoin suspension. What volume should be administered? Please use the correct unit. Okay, a patient is prescribed 100 milligram and our bottle comes in 250 milligram in 5 ml. So that means 1 ml is 50 milligram. You know how I got that, right? Divide both sides by 5, and then since 50 milligram is equal to 1 ml, so how many milligrams will give us, how many mils will give us 100 milligram? That, since we have 50 milligram in 1 ml, 50 times 2 will give us 100, so we are going to give 2 ml. I hope you understand. A patient has been prescribed levetiracetam suspension. It's something that is used for it is something that is used for seizures, people that have seizures. A patient has been prescribed levetiracetam suspension at a dose of 10 milligram per kg. So this person weighs 70 kilograms. What volume should be administered? That means the person is having 10 milligram per kg. That's 10 times 70, which gives us 700 milligram. So this suspension comes in 100 milligram per 1 meal, and we have to give the patient per kilogram, which gives us 700 milligram. So how many mil are we given? It's simply 1 times 7, which is 7 milliliters. A patient has been prescribed 60 milligram of flupentazole decanoate. What should be drawn up for the syringe? Please use the correct drainage. So this is very simple and straightforward. 20 milligram is in 1 ml, and we have to give 60 milligrams. So that means 20 divided by 60, which is 3. A patient has been prescribed 4 milligram of diamorphine hydrochloride. These are like medications for end of life, people that are dying. So like just to make them, we have medications to make them pain free, we have medications to get rid of their excess secretions, we have medications to sort of relieve them of agitation and all sorts of things. So a patient has been prescribed 4 milligram of diamorphine. What volume should be drawn up for the syringe? And we have 5 milligram in 1 ml. Now this one is a bit tricky. You know what, let's just do it like a maths calculation. Since 5 milligram is in 1 ml, how many milligram will be in 4 ml? Do it, cross multiply, and tell me your answer. Okay guys, so my answer is 0.8 mil using that method that I told you guys to do. I think there will be calculators on your computer, because you'll be using your computers, of course, so you have nothing to worry about. And your answer already says in 1 decimal place, so that should give you, your instruction says in 1 decimal place. That should give you like a sort of like nodding, like, okay, oh, this thing is going to be in a decimal answer. A patient has been prescribed pethidine hydrochloride at a dose of 0.5 milligram per kilograms. Your patient weighs 90 kilograms, so that means this person is already due for 45 milligram. So what volume should be drawn up for the syringe? So this person is to take 45 milligram, and it gives us 50 milligram in 1 ml, and the person is to take 45 milligram. So let's use the same method again to calculate it. 45 divided by 50, 0.9 ml. I hope you understand this, guys. I really do hope you understand. So what I did was this times this, it gave me 45. Then I brought this here. So 45 milligram is equal to x times 50, 45 times 1, divide 45 by 50, and that's how I got this. I really do hope you guys understand, but if you don't understand, I may have to offer a master class for this. It will be very affordable, but I really do hope that you guys understand, because I'm not doing this because I want to make money from a master class. I just want to help you guys to be able to learn these things by yourself without much stress. Okay, so the next question says, at what rate should you set the infusion pump to run? Okay, so we are to set up an infusion of 400 ml to run for 5 hours, and it's starting by 8. So all you just have to do is 400 divided by 5, because the time is asking like how many ml per hour. 400 divided by 5 gives you 80, so that's 80 ml. I don't think you need up to 30 minutes to finish this part, to be honest. So the same thing goes for this again, 1000 ml in 6 hours. At what rate should you set the infusion pump to run? Give your answer to the nearest whole number. So 1000 ml, you've got 1000 ml to run for 6 hours. Let me do the proper calculation, but that will be 1000 divided by 6. Is it possible? Okay, 16.67. All right, so your calculator would just be somewhere like this, 0.67. So give your answer to the nearest whole number. So that will be 167. Another question says, this is a blood, 800 ml, and to give for 5 hours. So how many ml per hour would you run? That's 800 divided by 5. So 800 divided by 5, that is 40. Let me just be sure. Okay, 160. Now we have gotten to the most tricky part. Okay, so all you have to do here is to fill up this. Now note that anything that is input is plus, anything that is output is a deduction. So what we have to do now is to add up all this input. So let's get our calculator. How many 125 do we have? 1, 2, 3, 4, 5, 6. 125 times 6 plus 150 is 300 plus 100. Everything gives us 500 plus 500. That's 1250. So total input is 1250 ml. Because if you read the instruction, it says if the patient has gained. So total output now, we've got 140 plus 180 plus 80 plus 200 plus 310 equals 910 ml. So we are going to subtract this from each other. So our final answer, don't forget the person gained. So it will be plus, what was that again? 340. I can't remember if there's supposed to be plus or minus in this total and total input and output, but let's just see, guys. We got everything, so you guys can see that it is very easy, honestly. So if you have enjoyed this video, make sure to like and comment and follow for more. How do I describe